Section A is about family and genetic background and has 5 questions. Why is this section important? Well, autism has one of the strongest genetic contributions of any neurodevelopmental condition. That means if other family members have an autism diagnosis, or even if they don't have a diagnosis, but they have autistic characteristics, that can be an important clue. So, question 1 is, does your child have a biological sibling diagnosed with autism? Large studies following hundreds of younger siblings, including the Baby Siblings Research Consortium, show that when one child has autism, the likelihood for a younger sibling rises from about 3%, which is the rate in the general population, to roughly 20%. So that's quite an increase in likelihood. Now, that doesn't mean a child will have autism, but it means closer monitoring and seeking out developmental evaluations earlier is a good idea. Question 2 is, does your child have a biological parent diagnosed with autism? Autism characteristics can run across generations, and research studies published in some of the highest quality journals, like the Journal of the American Medical Association and the publication Nature Genetics, show that autistic traits often cluster in families, sometimes with family members having milder features. Now, question 3 is, are there other close biological relatives with autism or autistic traits? Studies looking at extended family members show autism likelihood increases when autism features are present within the broader family, not just siblings or parents. Question 4 is, are there relatives with ADHD, learning disabilities, speech-language disorders, or intellectual disability? Well, genetic research studies show these different conditions share overlapping biological pathways with autism. So these diagnoses in relatives, well, that's also an important piece of information to have. Question 5 is, do you yourself, as the biological parent, identify as neurodivergent or feel you have autistic traits? So many adults recognize traits in themselves only after learning more about their child. Research on what's called the broader autism phenotype shows that traits can appear in subtle forms across generations.